Microneedling is one of the fastest growing cosmetic procedures in the world. It is minimally invasive, relatively affordable, and used by millions of people to treat wrinkles, acne scars, and skin aging. But here is what most content does not tell you. The clinical evidence base is significantly thinner than the marketing suggests. Today, I am going to give you the honest science. What microneedling actually does, what the evidence actually shows, what the real risks are, and who should avoid it entirely.
First, what microneedling actually is. Microneedling, also called percutaneous collagen induction therapy, works by creating thousands of controlled microscopic puncture wounds in the skin using fine needles ranging from 0.5 to 3 millimeters in depth. The device is either a handheld derma roller or an automated Dermapen, which delivers more consistent needle depth and spacing. Here is the biological mechanism. When a needle penetrates the skin, it creates a controlled micro-injury without removing or destroying the epidermis, the critical distinction between microneedling and more aggressive treatments like laser resurfacing or chemical peels. This micro-injury triggers your skin's wound healing cascade. Phase 1. Inflammation. Within minutes, platelet-derived growth factors, TGF-beta, and pro-inflammatory cytokines flood the wound site. A scientific report study confirmed that microneedling triggers an immediate synchronized upregulation of TNF-alpha, IL-1, and TGF-beta, alongside pro-angiogenic factors, including VEGF, PDGF, and FGF within the first 24 hours. Phase 2. Proliferation. Over the following 5 to 7 days, fibroblasts migrate to the micro-injury sites and begin synthesizing new collagen. Specifically, they produce type 3 collagen initially, the younger, more flexible form, which is gradually replaced by type 1 collagen over the following weeks and months. Type 1 collagen is the primary structural collagen of mature, firm skin. This process is essentially your skin rebuilding itself with new material rather than patching with scar tissue, because the epidermis remains intact. Phase 3. Remodeling. This is the slow phase, lasting 3 to 6 months. The newly deposited collagen fibers reorganize into a more structured matrix, skin density increases, and the visible effects of the treatment become apparent. Real collagen remodeling takes months. Anyone who tells you they see dramatic results in 1 week is likely seeing temporary inflammation-related swelling, not actual new collagen.
Now, what does the clinical evidence actually show? This is where I need to be more careful than most content. A comprehensive literature review published in Aesthetic Plastic Surgery identified 25 published studies on microneedling. The review concluded that most clinical reports are case series or small cohort non-randomized studies lacking methodological consistency. Level of evidence 4, the lowest tier in evidence-based medicine. That said, the mechanistic evidence is solid. A PLOS-1 study using a human 3D skin model confirmed time-dependent histological and molecular changes following microneedling, including upregulation of TGF-beta 1, 2, and 3. Histological biopsy studies show microneedling with radiofrequency increases dermal thickness by an average of 15 to 20% at 3 months. And a Journal of Clinical and Aesthetic Dermatology randomized controlled trial found statistically significant improvements in texture, fine lines, and wrinkles. The most compelling clinical result comes from histological studies with biopsies, actual tissue samples. Collagen and elastin deposition can increase by up to 400% over 6 months when microneedling is combined with PRP. Even standard microneedling without additives shows consistent collagen density improvements, which is a more reliable measure than self-reported skin appearance. What conditions does microneedling actually help with? Acne scars, strongest evidence base. Fine lines and mild to moderate wrinkles, reliable improvement. Skin texture, enlarged pores, overall skin quality, consistent. Hyperpigmentation and melasma, moderate evidence, with important caveats for darker skin tones. Stretch marks, limited evidence, slower to respond.
Now, the risks.
These are real and specific. The most important immediate risk is infection. Microneedling creates thousands of open channels in the skin. If equipment is not properly sterilized, aftercare is inadequate, or the procedure is performed on already compromised skin, bacteria, fungi, or viruses, including herpes simplex, can be introduced deeper into tissue and spread across the treatment area. This is the primary reason at-home microneedling carries significantly higher complication rates than professional treatment. Post-inflammatory hyperpigmentation, PIH, is the second major risk. It disproportionately affects people with darker skin tones, specifically Fitzpatrick skin types 4, 5, and 6. Microneedling triggers inflammation, and in skin that produces more melanin, that inflammation can trigger excess melanin production, leading to dark spots that persist for months. Work with a practitioner experienced in your skin type. Use lower needle depths and apply appropriate aftercare.
The third risk is paradoxical worsening. In psoriasis, the Koebner phenomenon can trigger new plaques at the needle injury site. In rosacea, microneedling can worsen vascular reactivity and trigger significant flares. In active acne, channels created by needling can spread P. acnes bacteria across the face. In all three cases, microneedling is contraindicated. Who should avoid microneedling entirely? Active skin infections, bacterial, viral, or fungal. Active inflammatory acne in the treatment area. Active flares of rosacea, eczema, or psoriasis. History of keloid scarring. Pregnancy and breastfeeding. Isotretinoin use within the past 6 to 12 months. Blood clotting disorders or anticoagulant medication. Undiagnosed or suspicious skin lesions in the treatment area.
The at-home versus professional distinction cannot be overstated. Professional microneedling uses single-use sterile cartridges, calibrated needle depth, consistent spacing, topical anesthetic, and aftercare guidance from someone who can assess your skin response. At-home derma rollers carry significantly higher risks of inconsistent depth, inadequate sterilization, and inappropriate use on contraindicated skin conditions. The evidence base for professional microneedling does not extend to at-home use. The evidence-based protocol from clinical studies, 3 to 6 sessions spaced 4 to 6 weeks apart. Needle depth, 0.5 millimeters for superficial texture, 1.0 to 1.5 for wrinkles, 1.5 to 2.5 for acne scars. Results begin appearing at 4 to 6 weeks and continue improving for up to 6 months after the final session.
The combination approach. The microchannels created by needling dramatically increase topical ingredient penetration. A 2022 scientific report study confirmed significantly enhanced delivery of growth factors and angiogenic signals through improved skin penetration after microneedling. PRP, the patient's own blood-derived growth factors, is the most studied and most effective combination. The honest summary of the evidence quality. Mechanistic evidence? Solid. TGF-beta, VEGF, collagen synthesis pathways confirmed across multiple studies. Clinical outcome evidence? Moderate. Improvements shown, but studies are mostly small and non-randomized. Long-term data? Weak. Few studies follow patients beyond 6 months. Microneedling is a textbook example of hormesis from video 7. Controlled microinjury at the right dose triggers the wound healing cascade, producing net beneficial adaptation. Too little? Minimal adaptation. Right dose? Meaningful collagen remodeling. Too much? Scarring, PIH, or worsening.
The honest summary? The mechanism is real and well understood. The results for acne scars, fine lines, and texture are consistent across available evidence. Evidence quality is lower than for other interventions in this series. Risks are real and specific. If you are considering microneedling, go to a qualified professional. Check contraindications first. Space sessions 4 to 6 weeks apart. Do not do this at home. Wear SPF 50 daily post-treatment. Manage your expectations.
Real results take 3 to 6 months. If this gave you a more complete picture, hit subscribe and the bell. Drop a comment. Have you had microneedling? What was your experience? I read every reply. See you next week.